The Victorian government is considering suburban lockdowns and coronavirus checkpoints to contain the growing number of daily infections across the state. High case numbers have been described as a genuine concern, but not a second wave. The largest daily increase in cases in nearly 3 months. 49 people testing positive after a record-setting 3-day testing blitz. None are return travellers. More than 40,000 people checked, a record 18,000 tested on Saturday. The state government, desperate to contain the spread, is considering shutting down suburban hotspots and virus checkpoints.
We'll do it if we need to. We'll do it if that is the appropriate response. But it's again another reminder, and I think just makes the point really clearly. Please come forward and get tested. If someone knocks on your door, take the test. It is incredibly important for you, your family and every Victorian family.
Overseas travellers who refuse to be tested for COVID-19 face an extra 10 days in hotel quarantine. Expensive fines could also be on the cards.
It is my judgment that if it was simply a fine and nothing else, then there may be some people in hotel quarantine, people of means, I'll give you one example, who might well pay the fine in order to get out. 10 days may be a far greater sanction than simply a fine. That option remains open to us.
Only 4 of Victoria's 49 new cases are linked to known outbreaks, sparking fears of widespread community transmission. Deputy Chief Medical Officer Michael Kidd describes the growing case numbers as a genuine concern, but says it's not a second wave.
It's important that Victoria continues to test widely and to rigorously follow up with any contacts, and to ensure people identified as cases and contacts remain in quarantine and isolation until advised otherwise by the state health authorities. This is not a second wave, this is an outbreak occurring, and the response which is occurring is very vigorous and appropriate.
Health authorities say they will have a clearer picture if the current unknown cases are linked to existing cases. A nervous wait for the state, hoping the current trend reverses in the week ahead.